My name is Dr. Cassie Gafford. I'm the clinical director of the Community Oral Health Sites at Penn Dental Medicine, which includes PHMC Cedar Dental. Historically, medicine and dentistry have been very separated, so it's really no wonder that patients think that dentistry isn't part of overall health. But that couldn't be farther from the truth. So, by having dental care in the same area as medical care, it really promotes this idea that oral health is part of overall health. So, in addition to treating teeth issues and gum issues, which can decrease inflammation and infection in the mouth, we also, as dentists, provide head and neck exams and oral cancer screenings. And sometimes we can diagnose health issues before a physician is even able to do so. And so, collaboration between dental professionals and medical professionals is really instrumental in a patient's overall health. And not only that, but when we position dental offices and medical practices in the same location or with a lot of communication, we as dentists have the ability to educate our medical professional colleagues as to the importance of healthcare. And so this really facilitates overall health for all of our patients. Many people go to their physician, but they haven't been to the dentist in a long time. So at PHMC Cedar Dental, we actually have public health hygienists and students who will go to the primary care suite and provide dental screenings for patients while they wait for their primary care physician, for example. We even help facilitate and make those appointments for people, which simply just makes it easier for them to get dental care. In addition, we educate all of our patients about the importance of oral hygiene, nutrition, tobacco cessation, and share information about how taking care of their mouth can affect their overall health. So, for example, many patients don't know that diabetes and periodontal disease are linked. And so, if you have uncontrolled diabetes, you can have a lot of gum issues, which can cause mobile teeth or tooth loss generally. And so, instructing and teaching patients how to take care of their teeth and get dental treatment, as well as getting their diabetes under control, can really affect their overall health in a positive way. Many patients don't know what medical conditions they have or how serious they are, or what medications they're taking, and sometimes even what allergies they have. And so, by having access to electronic medical records, as dentists, we can provide the safest care for our patients. In private practices, dentists typically do not have access to these records, and so we're provided with incomplete information about the health of the patient. As well, some of our procedures that we do in dentistry can have complications or health risks if somebody has systemic medical issues. And so, in a private practice, a dentist may need to reach out to a cardiologist to understand the significance and implications of heart disease, for example, or a significant history of strokes. And so, by having access to medical records, we at the dental practice can actually look up a patient's medical notes, look up their lab values of blood work, and then make the determination ourselves as to the safety of the procedure. This can eliminate a significant time barrier for patients, sometimes days or weeks, while otherwise we would be waiting for a physician. And it can provide and help us provide safe dental care to our patients. There can be many barriers for people to access regular dental care. The first of which is finances. Dental care can be prohibitively expensive for many people, especially if they have significant dental needs. Also, in underserved communities, sometimes there simply aren't enough dentists or enough dentists who take people's insurance if they have insurance. Another barrier is getting to appointments. If there aren't very many offices near your community, near your neighborhood, it can be challenging to take off work or find childcare, as well as access through good public transportation to get to those offices. So, community-based clinics can help reduce some of those barriers by providing dental care at lower cost or at no cost to patients, as well as having access to a location close to the community where they live in. The first thing I recommend is seeing a dentist for a dental exam and treatment. It's very common for patients to come in and feel embarrassed about their mouths, and maybe that's one of the reasons why they haven't come to the dentist. But I promise we've seen it all. Please do not feel embarrassed, and we're here to help you. We also want you to buy a soft toothbrush and use it twice a day with fluoride toothpaste, ideally once before breakfast and right before bed. Integrating flossing into your daily routine, while tricky to get part of your daily practice, is really important to decrease gum inflammation. So I recommend starting maybe once a week and increasing over time so that you can really decrease that gum inflammation and get healthy gums. Limiting snacking and not sipping things throughout the day can be one of the most effective ways of limiting your chance of getting cavities. And so every time you put food into your mouth or sugary beverages like coffee and sugar or soda, your mouth becomes more acidic, which is much more likely to get cavities over time. And so reducing your snacking, having food at meal times, rinsing your mouth out with water after you eat, and not sipping things throughout the day can be really beneficial for your mouth. And lastly, if you have children, we recommend you bring them to the dental office before age 1 and help them take care of their teeth and provide the importance for oral hygiene and oral health in general, because children who grow up with healthy teeth are much more likely to maintain them in adulthood.